Welcome to New Hampshire's Business. I'm Fred Coker. Healthcare in New Hampshire is being limited by an acute shortage of healthcare workers and professionals. Let me show you what I mean. Let's go to the graphic. 2,000 healthcare worker and professional shortages in New Hampshire, 11% of registered nurse vacancy rate in hospitals and medical practices, a 20% registered nurse vacancy rate in intensive care units, and 15% in operating rooms. 10% vacancy rate for physicians and medical assistants. And then this. 234 vacant positions for direct support staff. That's from 2018 in the fall. That's where the number came from. And then only 45% of mental health needs are being met. That is a current number, although there's some legislation in the State House that's going to help with that. With me to talk about this are two people that know this subject well. Joan Widmer, who is Nurse Executive Director of the New Hampshire Nurses Association. Joan, welcome.
Thank you.
Nice to have you here. And Christine Stoddard, Bi-State Primary Care Association, the Public Policy Director. Welcome.
Thank you, Fred.
Nice to have you. This is a serious issue. I mean, during my homework on this, I came to that conclusion very quickly. But how serious, Joan?
Well, the problem with the nursing shortage, which I'm most familiar with, is that we can't get enough nurses through the pipeline to refill the needs that are happening. We're constrained by issues of how many nurses we can graduate. This year the state will graduate about 540 nursing students, yep. And unfortunately a significant percentage of those students will go to other states to work.
That's still not enough.
It's not going to be enough to meet the 2,000 openings that we're looking at.
Christine, same question.
The bottom line is that patients are going without access to care. And not only does the shortage affect the healthcare organizations themselves, their bottom line, their ability to stand up programs, but it means that patients are going without the care that they need. And it's especially problematic for our elderly community. New Hampshire has one of the oldest populations in the country, right. And we have elderly patients going without the care that they need.
How did it get this way? How did we get into this hole? Christine, keep going.
Well, it's a lack of investment in our healthcare workforce pipeline. We don't invest in the programs that exist in New Hampshire that we know work. We don't invest in them at adequate levels. It's also a problem in retaining clinicians that we have when they graduate. We don't invest in programs enough, sufficiently enough to retain the students once they graduate.
To help them with their cost of their education.
Yes, we have a great program called the State Loan Repayment Program, and that is not funded at the level needed to keep people in New Hampshire and to bring people from out of state. Because we don't graduate enough, we have to bring people from out of state, and it's not funded at a level necessary to do that.
Same on the nursing front, Joan, how did we get this way?
Well, loan repayment is a big issue. The average nurse is graduating with $40,000 of school debt. Yeah. That's a big burden, and when they can look at neighboring states and make somewhere around 35 to 40% more per hour, they have a tendency to want to go to the higher paying states. Yeah. That's a big contributor to it.
Now, there is a solution that you both have worked on, and let's go to that. And it's Senate Bill 308 in the New Hampshire State Senate, which has just passed this past week, I understand. It raises New Hampshire's low Medicaid reimbursement rates. It invests in scholarships and student loan repayments, which we just talked about, invests in training programs, and streamlines background checks. Now let's go to the next graphic, because here is a New Hampshire Healthcare Workforce Coalition, which is the group, this is just a few of the 42 organizations, healthcare, business, and government, that made the case for this bill 308, which should get at the healthcare shortage. And you can see the organizations just in this short list, but there are 42 of them. 308, significant, right?
Yes, we started meeting in June with I represent the community health centers, and we started meeting with the community mental health centers to get an idea of what the problem was in New Hampshire, what the needs were, yep. And how we could fix it. And so we developed a plan. We started meeting with other organizations like Jones, and we now have over 40 organizations supporting this.
In 5 seconds, is this an answer?
I think it's a big step toward what needs to be done. There are other things that are done. There are other bills that also need to move forward that will help with the mental health and the behavioral health concerns that are companion bills that will help.
Joan Wedmar, who is Nurse Executive Director of the New Hampshire Nurses Association, thanks. And Christine Stoddard, who is a Public Policy Director of the Bi-State, which is New Hampshire, Vermont, Primary Care Association, thanks.
Thank you, Fred.